Rheumatoid arthritis is a painful condition of the joints that affects 500,000 people in the UK. We think T helper cells are really important in switching the disease on. And our work with patients has already identified a gene called BCL3 that is unusually switched on in the earliest stages of the disease. So my work in the laboratory is going to switch on and switch off this gene in T helper cells from patients and from healthy people to work out exactly what the function of this gene is in driving the disease.
Patients with asthma and COPD are prone to developing severe infections with respiratory viruses, and this can lead to acute exacerbations of disease. We know that exacerbations are a major cause of morbidity and mortality, and we have very few effective therapies available. The aim of my project will be to investigate in depth the expression and function of airway mucins, which are the principal components of mucus in the context of virus-induced exacerbations of asthma and COPD.
The purpose of this study is to examine the provision of support for doctors in training with mental health concerns. We'll use two methods. We'll carry out a research study of the literature, and also we'll carry out interviews and focus groups with service providers and doctors in training. Two groups will benefit from this research: the junior doctors themselves, who will be helped to access mental health services when they need it, and secondly, the public will be reassured that if a doctor they consult has had a mental health problem, they will be more likely to have access to help that they need.
Acute stress-induced cardiomyopathy, or Takotsubo disease, or broken heart syndrome, is the new kid on the block. It's the disease of the 21st century in cardiology. It presents like a heart attack, but it is not in fact a heart attack. It is distinctively different from one. We have previously shown that the hearts of these patients are very swollen and they profoundly lack in energy generation. So the research that we are embarking on to just now is to see to what extent the hearts of these patients eventually recover to.
So schizophrenia is a common mental disorder that can affect about 1 in 100 people, and it's a potentially devastating illness. We do have treatments available, but the treatments are only properly effective in about a third of the patients, so we really need to understand the illness better so that we can develop better treatments. The aim of this study is to try and understand some of the changes that happen in the brain when people have schizophrenia, and also whether we can manipulate that in people who don't have schizophrenia by using a drug intervention to try and model the illness. That will mean that we can potentially test out new drugs and new treatments in people who don't have schizophrenia without relying on animal models which are unreliable.
A large proportion of medical research is wasted because it cannot be synthesized in clinical guidelines, as researchers don't measure the same thing.
So because of that, there is a need to develop core outcome sets in women's health conditions so that future studies will all report the same outcomes.
Over 70 journals in women's health have come together to agree to meet this objective.
So we're delighted that the BMA grant will allow us to work with these journals and collaborate effectively to create more core outcome sets in women's health, which will improve women's health research in the future.
So asthma is a very common problem in the UK, with more than 5 million people suffering with this condition. And what's surprising is that up to 50% of these patients are not well controlled despite being on optimum inhaler therapy. Cough is a very common problem, but we don't quite understand what causes cough in asthma. We do know that cough is the archetypal airway neuronal reflex, and therefore my research project is trying to understand how inflammation in an allergen challenge model will affect cough responses. My hope is that this project would lead to development of novel medication to try and reduce cough.
Currently there is no effective screening strategy for ovarian cancer, and this has really been hindered by a lack of knowledge of the disease process. Recent evidence has shown that the carcinogenic pathway of ovarian cancer actually arises in the fallopian tube and not the ovary. basis of our study is to utilise this knowledge and compare the methylation profile of a large cohort of fallopian tube tumour samples against normal fallopian tubes, and then taking out the potential biomarkers from that and looking at it on a large scale serum screening data set.
In our increasingly aging population, degenerative diseases of the nervous system, such as Parkinson's, are becoming increasingly prevalent, leading to a major burden in the healthcare and social services. The aim of our research is to understand how nerve cells handle toxic proteins that accumulate in patients' brains, and by promoting their destruction, hopefully prevent the disease process. What we now aim to do with the support from BMA is to use small molecules that activate such pathways and hopefully lead the way towards the development of targeted therapies for Parkinson's disease.